Thank you for the Parkinson Society BC for inviting me here, and thank you for attending the AGM. So as Jean said, I'm going to be talking about some updates of exercise and some of the research we have going on at the Pacific Parkinson's Research Center, and kind of trying to connect it to some of the stuff that Stefano just presented on. So as Stefano said, he can actually study dopamine release and dopamine within animal models and within specific neurons. But how do we actually study this within clinical populations? Well, there's two ways we can do that, and that's through neuroimaging. And we have two different types of neuroimaging that we can use that we do at UBC. And that's PET imaging, so that's the image, the nice colorful image, and then we have fMRI. So this is kind of the main two imaging components that I'm using in my PhD thesis. So for PET imaging, if we zoom in, we can actually measure dopamine release within patients when they're awake, when they're alive, and we can actually see how this might change behavior and how we can actually modify this with specific things like exercise. So Stefano showed a similar image here, and this is a cartoon of a dopamine neuron. And what we have on one side is dopamine, on the other side we have dopamine receptors, and this is how these neuron or brain cells communicate. Well, how can we actually use this to our advantage, and how can we study this? Well, we can use radioactive particles, and when we combine that to a medication, we can inject this into your body, and we can see where that radioactivity goes. So I'm going to use Rocky to denote dopamine, and we're going to use his nemesis, Clubber Lang, played by Mr. T, to represent our radioparticle. So in this case, it's called raclopride. And we know, as just like Rocky, there's a competition at that receptor. So both dopamine and raclopride will try to go to the dopamine receptor. But as we also know from Rocky, Rocky wins. So dopamine will bind to that receptor. So how can we actually use this to understand dopamine release within patients? Well, at baseline or at rest, there's not a whole lot of dopamine actually being released within this cell in response to a stimulus. So raclopride, or Mr. T, is free to bind to that receptor. And when raclopride binds to that receptor, we get a very colorful image, and we see a lot of radioactivity in a specific area of the brain. And that area for this tracer is the striatum or the basal ganglia. We know the basal ganglia is very important in Parkinson's, so this is where we want to look. We can then expose the patient to many different types of interventions. For example, we can give a patient amphetamine, or we can give the patient levodopa, which we know will release dopamine, or we can do things like exercise or repetitive transcranial magnetic stimulation. And that's the picture down at the bottom where we have that kind of figure-8 looking machine over someone's head. And what we can do there is we can stimulate at a very high frequency to actually release dopamine within the brain. So after that intervention, we're going to have both Rocky and Mr. T, so both dopamine and raclopride within the synapse or being released. And as we know from the previous thing I showed you, dopamine will now bind to that receptor. So when dopamine is bound to that receptor, we don't get as much radioactivity that we can see in our scan, so we actually get less colorful images, but that difference we can measure is actually a measure of dopamine release. But how can we actually use this to understand exercise in Parkinson's? We know that there's so many different types of exercise out there. We see Becky Farley's power program, we see the rock steady boxing, we see forced exercise, and we also see things like yoga or tango or dance, and all these are showing benefits of Parkinson's. But are they actually showing changes in dopamine release? Are they looking at changes within neuroplasticity, for example? We're not quite sure yet. So that was the main questions we are trying to answer in my PhD thesis, is how the brain is actually changing with exercise. So the two things that we were looking at was there changes in dopamine release, and was there changes within the cortical circuitry or the circuitry that's communicating within the basal ganglia. And that's what we actually did. So we designed a study here that actually used that tracer, the raclopride, used TMS, in conjunction with exercise to see how the brain changed. So on the far left-hand side, we have the baseline protocol. And what we do is we do a PET scan, and then we stimulate the brain, and we immediately follow it up with another PET scan. And that gives us a measure of RTMS, repetitive transcranial magnetic stimulation, induced dopamine release. We then will randomize patients either into a cycling group or a yoga group to see the differences between these two types of exercise. And then we'll follow it up again with those dopamine release scans. And this will give us a measure of corticostriatal plasticity, or how the brain is changing, how the cortex or the outer part of your brain communicates with the striatum or the basal ganglia, to see how that circuit actually might change with Parkinson's or change with exercise, and how we can use this to our advantage for benefits. So the questions we were trying to answer was, does 3 months of exercise change the basal ganglia circuitry? And does 3 months of exercise increase dopamine release within patients? So here are some preliminary images that I have between the two groups. So this was our stretching group. And on the one side, that says baseline, that's before we do any stimulation. And then the after TMS is after we do a stimulation. And what we would expect to see is a reduction of the radioactivity or a reduction of those red and yellow colors. But as you can see, denoted by those white arrows, there's not a lot of difference. If anything, there's even a little bit more red after the stimulation. So that actually shows there was not a lot of dopamine actually released in result of the RTMS. Now, if we look after, again, that stretching group or our yoga group, again, we see no real visual difference between these two images. There's no real change on that side that's denoted by the white arrow, meaning that there's no real change to this circuitry or no real change to dopamine release. Now let's look at the aerobic group, or a group that cycled 3 days a week for 3 months. And what we see at baseline, there's, again, no real difference. There's no difference between these two images. But after 3 months of exercise, what we see is in that area denoted by the white arrow, there's a reduction of that warm, hot red color. And that shows that there was some dopamine release. So what we see in the graph here, the green and purple bars was our control group, our stretching group, and the blue and red bars are our aerobic group. And we see we have an increase after exercise in the blue and red bars, showing that there was an increase in dopamine release after 3 months of cycling exercise. So this was quite promising. It's still very early days, but it does suggest that aerobic exercise causes greater RTMS-induced dopamine release. It suggests there might be a change in that circuitry, the basal ganglia circuitry within the brain, which might be resulting in increased dopamine release. However, this isn't a small sample size so far, so the data I presented was only in 9 people in the aerobic group and only 4 in the control group. We just recently collected some new data in the past couple weeks, so that's going to be added, and as the data set fills out, hopefully these results still hold true. It also doesn't necessarily answer the question why we're getting increases in dopamine release. Is it perhaps related to the increase in exercise? Maybe it's the novelty of exercise. Everyone who we recruited for this program hasn't really done much exercise at all. They're not these habitual exercisers, so maybe it's just introducing them to a cycling intervention that might have caused dopamine release. Perhaps it's growing new neurons. These are all questions that still need to be answered. And before you get all excited and say, I'm going to go out and buy a bike and start cycling, there are other questions that we do need to answer. For example, why did we not see this change in dopamine release within the yoga group? We've seen yoga has been beneficial in the past. Perhaps it was the expectation for exercise. Perhaps people said, I'm enrolling into an exercise study, I'm going to be doing this high intensity exercise, so I have this expectation. I know Dr. Stoss has done a lot of work within the placebo effect, so perhaps there's some of that placebo effect occurring within this study. And also the enjoyment of exercise. Perhaps people enjoy, maybe not at first, but over time enjoy having that sweat response, feeling like they've accomplished something at the end of the exercise session, and they don't necessarily get that with the yoga group. So these are questions that still need to be answered. And there's another way we can actually answer this question within the study. And that's where we can go back to the fMRI. And so we can, with fMRI, we can see how the brain reacts to different stimuli and different behaviors. So for example, if we want to look at how much you enjoy exercise or how much you enjoy something, we can look at your brain responses to things that you enjoy. And what's something that we all enjoy? Well, money. We all like getting money, so we're going to study the brain when you receive money. So what we did is we designed a task where people play a card game. And we put them into the MRI scanner, and they can choose cards, and if they win, we can see what happens to the brain when they win versus when they don't win. So this was the anticipation phase. The most important part within winning or reward is the point prior to actually receiving reward. For example, when you have a slot machine, it's when you have the 1-7 and then the second 7 and your heart rate increases a little more and you get a little bit more excited, and then the third 7 might not come, but you still had that release of dopamine even though you didn't win. So we're really interested at looking at this anticipation of reward. And then the second phase we'd actually look at is the reward itself. What happens when you actually win? And we have a little smiley face, you win some money, and it goes into your bank, and you can see how much you win over the 1-hour scan. So we give 50 cents per trial. We look at 4 different probabilities of winning. So we look at 0% as a control, and then we look at what happens when you have a 50% chance of winning, or what happens when you have a 75% chance of winning, or what happens when you have a 100% chance of winning. And we can look at how these different probabilities might modulate how the brain actually changes, or might modify how the brain responds. So for this, we looked at 2 different groups of individuals. We had one data set that had habitual exercisers. So these are people with Parkinson's. They're very impressive. They're running marathons. They're exercising every day. They're highly active. And then we compare them to these non-exercising or sedentary individuals. And these are people who are not as active, not necessarily doing exercise day to day. And then on the other side, we then took those people who don't exercise every day, and then we enrolled them into our 3-month exercise intervention into either the aerobic group or the control group. So the first thing I'll show you here is the habituals versus non-exercisers, sedentary. And the 4 figures you have there are the 4 different probabilities. So 0%, 50%, 75%, or 100% chance of winning. And we have a percent signal change. We want to see how the brain signal actually changed in the anticipation phase of the reward. And the one thing that's really interesting was at the 75% chance of winning. We see the red line, which is our habitual exercisers, and we compare that to the blue line, which is the sedentary. We see there's quite a bit of difference. We see that red line really increases in their percent, so their brain becomes more active before that, where the non-exercisers stay fairly blunted or fairly apathetic within this probability. So it suggests habitual exercise increases the response to monetary rewards, specifically at this 75% chance. So it suggests exercise might actually change this reward circuitry. And we know this reward circuitry is related to dopamine, so there could be the link there. However, this is a cross-sectional retrospective study, meaning that we only study people at one point in time. There was no intervention, so we're stuck with the chicken and the egg question. Are these habitual exercisers, does exercise actually impact this response, or is this response actually making these people exercise? So to answer that question, we can then look at the people who we've enrolled into the intervention. We've taken these non-exercisers and made them exercisers, and we want to see if that actually changes the brain response. So at baseline, those graphs over on the left-hand side, you can see both groups, the control group's on the top and the aerobic group is on the bottom, and there's no real difference between all the probabilities. All the different colored lines are the probabilities. We can see they look fairly similar. However, after the 3-month exercise intervention, you can see the control group, which is on the top. The red line specifically comes down, and that's the 50%, and likewise with the green line comes down at the end, which is 75%. If we compare that to the bottom figure, we see those red and green lines, those go up in the aerobic group. So we're seeing an opposite effect, where the aerobic group actually increases the response to the 50 and 75% probability, where the control group decreases their response. So it suggests that exercise does actually impact the reward circuitry in the brain. We're getting a similar response at 75, just like the habitual exercisers, and we're seeing this after 3 months of exercise, where exercise might be changing your brain in this sense. So it does show that aerobic exercise may alter the anticipation of reward. Similar limitations, so we do again have a small sample size. It's slightly larger in this cohort as the previous study, but we are continuing to recruit more patients for this study. And also, this was in response to monetary reward. So does that change in monetary reward actually result in changes to exercise, to the response to exercise? That still remains to be unseen. And we also want to investigate those mechanisms that underlie these changes. So the take-home message, we see that PET imaging actually shows changes in dopamine release within patients, specifically to aerobic exercise, and potentially through neuroplastic changes within the brain. fMRI neuroimaging showed us that the brain reward circuitry will change in response to exercise, but more research is really needed to really truly harness exercise as an adjunct therapy for Parkinson's. So what can I recommend? Do what you enjoy. You want to get that reward, you want to get that part of exercise, and the only way you're going to do that is actually doing something you like to do. So find a type of exercise that you like to do, that you're encouraged to do. Find something to do with your partner, as you can have a good support system there. Do something you can tolerate. Don't push yourself so much that you're going to get some injuries or be so fatigued you can't do the things that you want to do. Find something that will actually fit your needs. And constantly switch it up. If you continue to do the same exercises over and over and over again, then your body's going to become accustomed to it and not see those effects. So continuously switch it up every couple of months or so. So if you need any ideas, you can follow the Canadian Physical Activity Guidelines. These are on the CSEP website, or if you just Google Canadian Exercise Guidelines. The Pacific Parkinson's BC has done a great job on their website outlining all different types of exercise that you can join. Different support groups will have other information as well about different exercise programs you can enjoy. And finally, remember, exercise is the only prescription with unlimited refills. So continue to get out there, do lots of exercise for the betterment of Parkinson's. So with that, I would just like to thank the whole group at the Pacific Parkinson's Research Center. If you are interested, I've put my email there and our research email, as well as my phone number. So if you have any questions or if you're interested in research, feel free to give me a call or send me an email. So thank you for listening, and I guess it's close to lunchtime, right?